Welcome to Live, Work, Thrive. I'm Michaela Birmingham, Scary Mommy Executive Producer. Tonight's event is brought to you in partnership with the Ad Council as part of their national It's Up to You campaign, aimed at educating the public about COVID-19 vaccines. In this episode, we will be sharing critical information for all parents. While children 12 to 17 are eligible for vaccination now, as many of you out there are waiting, the vaccine for ages 5 to 11-year-olds is likely to be authorized very soon. And I know parents have a lot of questions. Tonight's conversation will be a chance to hear directly from medical experts and doctors who will provide the latest information and answers to questions that so many of you have asked. Specifically, tonight's discussion will cover an explanation of how a safe and effective children's vaccine was made available so quickly, how to think about getting the children's dose versus an adult dose for your 11-year-old turning 12, debunking the myth that there is a link between the vaccine and disruption in fertility in girls. And of course, we will be taking your questions live throughout the broadcast, so please put them in the comments wherever you are watching, and we will get to as many as we can. Let's meet our panelists. Tonight, we have with us Dr. Lee Savio Beers, President of the American Academy of Pediatrics, as well as Professor of Pediatrics and the Medical Director for Community Health and Advocacy at Children's National Hospital. Her research includes adolescent pregnancy and parenting, mental health, and pediatric primary care, as well as the impact of adversity and stress on child well-being. Thank you so much for being here tonight, Dr. Beers.
Thank you so much for having me here tonight. It's really such a pleasure.
Also with us is Dr. Katelyn Jetelina, an epidemiologist and assistant professor at the University of Texas Health Science Center School of Public Health. She's also the founder and author of Your Local Epidemiologist, a viral international newsletter that translates public health science like COVID-19 to the public. Thank you so much for being here, Dr. Jetelina.
Hi, thanks for having me.
Later on in the show, we will also hear from Dr. Jason Salama, Associate Professor of Epidemiology at the University of South Florida. Since the onset of the pandemic, Dr. Salama has been an important figure in Florida on the dissemination of data through the COVID-19 Kids National Tracking Dashboard. Also, we will hear from Dr. Kelechi Iheagwara, Medical Director of the Pediatric ICU at Our Lady of the Lake Children's Hospital in Baton Rouge, Louisiana. She will describe the scene at her hospital where the situation is dire for both pediatric beds and nursing staff. Before we get started, we have a few quick reminders for the audience. Submit your questions in the comments wherever you are watching, and we may feature your question later on in the show. Join our mailing list so you don't miss any of our upcoming virtual events. Visit scarymommy.com/liveworkthrive to sign up and stay in touch. Throughout tonight's panel, if you get the urge to read things on the internet, let it be from these two reliable sources: getvaccineanswers.org, which is at the top of the screen right now, and healthychildren.org. All the information there is legit, no fake news, and it's been vetted by actual doctors, not your cousin's sister's friend. All right. So there's even a special section devoted to parents where you can find answers to the most commonly asked questions. Okay, so let's get into tonight's topic. Dr. Beers, first, let's talk about what everyone wants to know: how soon the Pfizer vaccine will be authorized for children. As there are several steps involved here, can you tell us, when do you expect shots to be going into the arms of children 5 to 11 years old?
Well, thank you. You are that's very true. This is the question that everyone wants to know the answer to right now. And I think we're close to having an answer to that. I think the short answer, and then I'll walk backwards from it, is early November is when we expect the vaccine to be available for children ages 5 to 11. Now, a couple caveats to that, right? Of course, that assumes that each step along the way progresses, each remaining step along the way progresses in the way we expect it to. And certainly we've seen no reason to think otherwise. And with the previous times that we've looked at the vaccine for 12 and up and 16 and up, it has gone along as expected. So next week, actually, on the 26th of October, the FDA will be meeting to review the data that has been submitted to them around the vaccine for 5 to 11-year-olds. And if all goes as expected, if all goes well, and they authorize that vaccine for that age group, it'll go on to the CDC for them to take a look at. And that's going to happen the first week of November. So then one thing I really want to emphasize with everyone, as soon as that's authorized, assuming that goes well and that's authorized there, everyone's going to be, those of you who want the vaccine, they're going to be ready for it, but it is still going to take another couple of days, maybe even a week or so before we can really have access to the vaccine. And there's a couple of reasons for that. The vaccine is actually a different dose. And so it's coming in a different vial. And so the states have to make sure that they can get that vaccine out to all the places who are going to be administering the immunizations. They have to make sure everything is set up. And from everything we hear, they've got everything in the pipeline to make sure things go quickly and smoothly. But just to know it is, just so to help with expectations, it may take another couple of days, but it's coming, and it is assuming all goes well, it's coming very soon.
So that's a good point. Any parent who wants to call their provider or their pharmacy should be asking if they have the pediatric dose available, right? Because it's different than what's been previously on offer. Is that the case?
Yeah, it is the case. I think, actually all the providers who are giving the vaccine definitely know this. They're prepared for this. And so they, they will, and actually many of them, may not, it hasn't been authorized yet. So they don't have it yet. So I think just, what you could do though is reach out to your pediatrician's office and find out, hey, are you guys planning on having it? What are your plans? How are you getting things set up? How should we let you know that we're interested in an appointment for it? And if they don't think they'll have it right away, where do you recommend we get it? What are your suggestions for us? So doing a little pre-planning around that will be helpful. But I think it's just, I want to make sure parents know that it's going to take a moment for everything to get where it needs to get. But pediatricians, everyone's working so hard to make sure that once the vaccine is authorized and available, we have it, and we have it ready to go for you.
All right. So moms, give the pediatrician some grace. They might not know on the day of what the deal is, but you can call in, check back, get the facts. I like it. Okay. So Dr. Jetelina, there is a misconception out there that this vaccine was rushed, developed too fast to be safe. Some parents have said they don't want their children to be the quote unquote guinea pig. Can you shed some light on the testing and clinical trials that have gone into that vaccine for children?
Yeah, absolutely. I think so rushed is very different than speed. There's a lot of things that went into us getting this vaccine so quickly. One is, I think a lot of people forget or don't even know that our research into the mRNA vaccine started in 1961. The first clinical trial was in 1993 for the flu vaccine. And so we've been testing this technology for a while. And so what we were able to do was leverage this research, leverage our understanding to try and test it with the COVID-19 vaccine and FAAP bubbles. And so that combination of those two started off us on the right track to get the vaccine very quickly. The other thing that we kind of, I think as a public discount is that there was a ton of money and the entire world was working towards this vaccine at once. That never happens. As a researcher, I have to go for years to try and talk the government into giving me money for my research. And so that was certainly unprecedented as well. And so the other third thing is we had volunteers flooding our clinical trials, raising their hands to participate. And that is also not normal. It's usually very difficult to get people to participate in clinical trials. And so all three of those really worked together so we could get this vaccine in a speedy way because we needed it. This pandemic is severe and it is severe for kids as well. And so we needed to get this vaccine as quickly as possible, but also safely. And so all of these vaccines went through our typical process, phase 1, phase 2, phase 3. And there were we didn't cut any corners doing that. And so the other thing is, usually when we roll out a vaccine, it's an age de-escalation process. So we start with the adults, We already saw the adults getting it. Then we go to a little younger, 12 to 17. And now we're finally at 5 to 11-year-olds. And so this is all the normal process. And we can really be confident that this has been in the development for decades. And we're very lucky that it got to us so quickly.
Okay, I like it. It's old. The thing is old, people, since the 60s. I don't want anything new. This is from the 60s. Fantastic. It's like your dishwasher. The older ones last longer and they work better. Okay, so if you're watching right now and you have questions, don't forget, put your questions in the comments and we're going to be taking those throughout our broadcast. So Dr. Beers, let's talk now about some of the misunderstandings that are floating around out there, especially with respect to the vaccine and children. As the head of the Academy of Pediatrics, you are the last person to recommend anything that would be potentially harmful to a child, right? You're like the queen bee of children. So let's talk specifically about one misunderstanding we hear about. Tell me, clarify for us all, this talk of a link between a disruption in fertility and the COVID-19 vaccine in young girls. If I have one more mother calling me up and saying, well, she doesn't have her period, I'm not getting the shot, I'm going to lose it. So tell me, what's the truth?
Absolutely. Happy to. Well, and I think maybe before I start, the first thing I'll share is not only am I in this role as a pediatrician, but I'm a mother myself. And I have a 16-year-old daughter who's fully vaccinated against COVID-19. And I would, I would never have done that if I didn't have full and complete confidence in the vaccine and in the safety of the vaccine. And with the question about fertility, there's no link between the COVID-19 vaccine and any concerns or problems with fertility. And I think we know that for a couple of reasons. Whenever we think about sort of what, we always do this with vaccines, with medications, with any kind of therapeutic, we think to ourselves, what are potential side effects? We want to make sure that anything that's being developed is safe and is effective and that the benefits of it far outweigh any risks. So we think about sort of biologically, what would make sense? What could be a side effect we might see? We call it biologic plausibility. And so the first thing to know is that there's really no, what we call biologic plausibility that the COVID-19 vaccine would impact fertility. There's just no sort of link that might cause that. So that's one thing. The second thing we know is that, we've had at this point, millions and millions and millions of people in the country and worldwide who have gotten the vaccine. And we've actually had a very careful and close monitoring system for that even after the vaccine has been given, even for people who weren't in clinical trials. I know myself, when I got it, there was a little website, app you get, and they send you text messages. So you can send back to them any potential symptoms. They ask you all sorts of questions. And so what we've known is actually, there've been lots of women who have gotten pregnant after they've gotten the vaccine. So we've also just seen that in real life. We have heard some reports that sometimes women said, well, my period might have been a little bit different, and that's not a clear link, but it's also resolves right away. And we think if it is happening, it's probably related to the fact, just like sometimes you get a little fever, you feel a little under the weather when you get the vaccine. Sometimes we all know, right, if we're just day-to-day things, if we're getting stressed, we're running around a lot, sometimes that might throw our period off a little bit. It's that same kind of thing, right? So you just, you might feel a little under the weather, it might throw your period off for a day or two, but there really is no link between the vaccine and fertility.
Okay, moms of daughters, you heard it here from the queen bee, no link with the fertility. All right, I love it. Okay, Dr. Jetelina, another one that I'm hearing is, we don't know the long-term effects of this vaccine. Can you tell us, has there ever been a vaccine historically that has shown adverse effects several months or years down the road that you know of?
Yeah, so typically with vaccines, the adverse events happen within 6 to 8 weeks after initial inoculation. And so we actually saw this in real time with the mRNA vaccines. There was a safety, and the Johnson & Johnson, there was a safety signal detected within a month of us inoculating. One was the blood clots for Johnson & Johnson, and then for the mRNA vaccines was the myocarditis. And so I'm very confident in, like Dr. Beers was saying, our surveillance systems. We have active and passive surveillance systems. It's the most surveillance we've ever had with any vaccine. And so I'm very confident because we did find those safety signals. The other reason is, like Dr. Beers said, there's no really biological plausibility of why this would happen. The mRNA vaccine degrades really quickly. And it was actually one of the reasons why we had such a hard time getting mRNA vaccines in clinical trials until now. It's not because they weren't safe. It was because the mRNA degraded so quickly, we needed to find something that it could travel and give us the instructions long enough. And so mRNA degrades within 72 hours. The fat bubbles that carry the mRNA degrades within 4 days. So nothing's like lingering in our body for decades. It gives us the instructions and then leaves. And so there's no reason to think that there'll be long-term side effects. And then to add to that was the previous clinical trials. We've had clinical trials with flu mRNA vaccines, with cancer mRNA vaccines, with some mRNA therapeutics, and nothing safety-wise has been popped up from those that started decades ago. And so we're really confident that there will be no long-term side effects to the vaccine.
So I just want to clarify for folks, because you did mention the safety surveillance where there was, I guess, a notification on the myocarditis and the heart or blood clot. So I would just like you to characterize the risk of those adverse impacts versus the benefits of the vaccine for people, just so we're clear that those incidences are very rare.
Yeah, it's exactly that, a risk benefit ratio. Do the benefits outweigh the risks? That, like I said, there is a true safety signal with myocarditis among young males, particularly, and the COVID-19 Pfizer vaccine. It is very rare. I will say that, very rare. I mean, we're talking, I think it's about 27 cases per 1 million people vaccinated. And so this is a safety signal we could have never identified through clinical trials. We just don't have enough people to assess that safety signal. But it is rare, but it is true. And so what we've seen was a study that just came out a couple weeks ago, was that after 6 months among those cases, the young boys fully recovered. So these were very mild cases. They didn't die. No one has died in the United States because of the myocarditis. So it is mild, but it is there, especially with this second dose. We see it flare up a little more. I think that answered your question.
Yes, no, that's very helpful. And we're getting some.
If I could add on that too, the other thing that I would add, I 100% agree, but I would also add and remind us that actually getting the COVID infection can cause myocarditis, and it can cause very serious myocarditis. I mean, when we talk to our pediatric cardiology experts, and of course, in addition to having a 16-year-old daughter, I have a 13-year-old son. So these are all very sort of real, relevant things that I think about as a pediatrician and as a parent. But when we talk to our pediatric cardiologist colleagues, they say, no, what we see is kids who have gotten COVID, who've gotten sick with COVID, who are in our clinics and in our hospitals and in our ICUs, who are very, very sick. So the risk of actually getting, if you get COVID, the risk of getting myocarditis from COVID is much, much higher. And if you do get myocarditis from COVID, it often is a much more severe case. So I think that's really important to remember too, when you're thinking about that risk benefit ratio, is that you can get quite sick from COVID, and myocarditis is one of the things that you can get, and it can be very serious when it's from the infection.
That is a great point. And we're going to hear later on coming up from a pediatric ICU doctor who's going to tell us a little bit about what she's seeing in the cases in her hospital in Louisiana, where they have a surge happening. So on this topic, there's a few questions coming in from the audience about myocarditis. And so I want to get to those, because a big question we're hearing from parents is, I have an 11-year-old. They're going to be eligible potentially November when the authorization comes through. They're turning 12 in December. Should I wait till they turn 12 and give them the adult dose, or is it safer? Does the risk go down at all of these potential rare side effects like myocarditis? Should I wait? What do I do? Dr. Beers, what would you say to this parent of an 11-year-old?
So, what we're recommending is that parents get the vaccine that is available to them as soon as they can, right? And so that means if your child is 11, when the vaccine is authorized for 5 to 11-year-olds, that's when we recommend it. And I think it's important to kind of think about why there are different doses, perhaps for different ages. This is something, again, very common that we see in vaccine development, because it's not actually, lots of medications, like if you're going to take a medication for your fever or something, that's based on your weight. Vaccines are different in that way. Vaccines are actually based on how your immune system responds, and that's really more related to your age and the maturity of your immune system as opposed to your size. And so that's why it feels a little strange and confusing to families to think sometimes like, well, my 11-year-old is actually bigger than my 13-year-old. So, why are they getting different doses? But it's not necessarily about size. It's really about the age and maturity of your immune response. So.
Got it. Okay. So your tall child, it doesn't matter. It's the immune response. Don't care how tall they are. Just get them the dose for the age of the child. Okay. Love that. All right. So let's talk now about what's happening in Miami. I have to mention this because today, all over the news, this school is requiring vaccinated students to stay home for 30 days. Now, Dr. Beers, please clarify the misinformation here. We don't want to spend too much time on this, but I want to debunk this theory that vaccinated kids can somehow shed the vaccine to others.
Yeah, I guess the short version is that's absolutely not true. So, Dr. Jetelina sort of explained a little bit, right, about how the vaccines work and how quickly the mRNA vaccine leaves your system, and it's just stimulated an immune response, just like anything else might stimulate an immune response. I think so. First of all, that's not true. Second of all, I think one of the important things for us to remember and emphasize, and this is the case on so many different levels, it's so important for our kids to be in school, and for them to be in school as much as possible, and for us to really be thinking about how can we create environments, how can we make sure that we're keeping kids as safe as possible and minimizing their exposures to COVID so that they can be in school as much as possible. And I think this is one of those cases, right? It's important for kids to be in school, and we want to make sure that we're doing everything we can to make that happen.
Yes, get the children out of my house, please, Lord. I do not want them in my house anymore. Okay. Now, this is a great segue to, as I mentioned earlier, the fact that tonight's show is brought to you in partnership with the Ad Council. It's part of a historic public education campaign. Now, if you are old like me, you probably remember the iconic Ad Council campaigns with Smokey the Bear, a mind is a terrible thing to waste, all of those catchy phrases that we still remember today. Let's take a look now at one of their recent PSAs that shows real conversations between vaccine hesitant people and their loved ones.
Scene 103, take one.
I thought we'd be on the same page about this, and we're not.
How do I know the way I'm going to respond to it?
I want you to get the vaccine because I want you to be safe.
What if you end up in the hospital? That's what I'm scared of.
If you was to die, man, that would literally kill me, man.
I hug you.
Yes. If it made you feel that way, bro, I would probably do. I love you, man. I love you too.
All right. I love these spots because they're real conversations. This is happening in a lot of our, our family circles, relatives. Everybody's got that cousin who doesn't agree, right? So, Dr. Jetelina, disagreement between family and friends, about this issue of vaccines can be stressful, especially for parents. What advice would you give to a parent out there whose child is still too young to be vaccinated when it comes to visiting unvaccinated adults? Should you ghost Aunt Linda completely? Is it okay to visit if you sit outside? We need to figure this out by Thanksgiving because the moms are like, we're losing our minds. What is the advice? We still have this vulnerable, cute little section of the children who are not going to be vaxxed. How do we handle this?
Yeah, that's completely right. That our kids don't have an immunity wall right now. They're not immune to COVID-19. there are certainly severe cases among kids. And so I have 2 kids, 2 under 2, so they're unvaccinated right now too. My husband and I have a strict rule that they're only around other vaccinated people. Thankfully, our entire family is vaccinated. If they weren't, I would strongly suggest, if there were adults not vaccinated, I would strongly suggest that one, have a conversation with them. It's still time before Thanksgiving for them to be fully protected. Unvaccinated people change their mind. About 30% of them have changed their mind because of conversations with family and friends, not because Dr. Jetelina on your local epidemiologist told you. So one, open up those conversations before the holidays. 2, if that doesn't work, you gotta wear masks at this event. If it's possible, have it outside. Air helps a lot. Air circulation helps a lot. Maybe have a fan on. I know you're in New York, Michaela, so that may not work very well, but maybe in Texas it would. So really continue with those public health mitigation measures until everyone's had the opportunity to be fully protected against COVID-19. We are I will say, slight worried about the winter months because coronaviruses are seasonal. There's no coincidence that our largest wave was in December and January. And so we want to continue the decrease in transmission and go into the winter months with as much protection as we can.
So that is a great point. Winter is coming, as they say. Dr. Beers, what can you tell us about the Delta variant and the children? Should we, even though we're hearing occasional breakthrough infections, why is it still really important to vaccinate our kids? And what can parents expect this winter? Is it going to be a flu, RSV, COVID bonanza? Do we have to hunker down? I mean, I don't even want to think about it. What's going to happen?
Well, I would say to some extent what happens this winter is up to all of us, right? I think we have some control over this. We have control over getting ourselves vaccinated, our children, if they're eligible to be vaccinated against COVID-19, but also, of course, against the flu. If we're vaccinated against the flu, that helps decrease the spread of flu as well. So I think that's one important point, is that to some extent, or to a large extent, actually, we have control over what the winter looks like. I think to respond to your question about Delta, I think, again, this is something well known to everyone now, but the Delta variant of COVID-19, of SARS-CoV-2 spreads, much more quickly amongst anyone who's vulnerable. And certainly it spreads much more quickly, again, among those who are unvaccinated, or almost solely amongst those who are unvaccinated. And so, if you have a virus that's spreading even more quickly, it means that even more people are going to get infected. And that's one of the things we saw with the big increases of numbers of children getting infected in this most recent wave, because the virus was spreading much more quickly and much more easily. And we had a greater percentage of our population who were unvaccinated, who were children, simply because they weren't eligible to be vaccinated. And so that's a big part of why we saw so much more COVID in children this summer and fall. So I think, those are all kind of important things to keep in mind. But I think, kind of the bottom line is we should, it's important for all of us, and each and every one of us, we can do things to protect ourselves. We can do things to protect those around us by, getting vaccinated if we're eligible, as Dr. Jetelina said, wearing masks. If you're have unvaccinated children who are around, unvaccinated adults, different situations like that. So we have the ability to help make things better for this winter.
It's up to us, as they say, right? Yeah. So, okay, Dr. Jetelina, I want you to help answer a question that we're hearing from our live audience right now. This person asks, with waning immunity from vaccines and the lost risk for children, I don't know what that means, but the essence of the question is, wouldn't it be better for children to gain natural immunity? Is there such a thing?
There is such a thing, actually. So if you're exposed to a virus, like SARS-CoV-2, you have the ability to mount a natural immune response. The challenge is with natural immunity is one, it also wanes, but two, it's really random who gets protection and who doesn't. We don't have a really good sense on how to predict if you're going to get natural immunity or not. Some studies show that, if you ended up in the ICU, you seem to have pretty darn good natural immunities. But also those that are asymptomatic have some good natural immunities and vice versa. Some people in the ICU don't have natural protection. And so that's what the vaccine does, is it's very uniform. It also has a really tight response. It's very targeted. The vaccine tells the body exactly what to go find, what to protect yourself against. Natural immunity is a lot more messy. Natural immunity can sometimes have less areas to connect to the virus. And so, yes, natural immunity is a thing. It's not necessarily all the time as good as vaccines, and it certainly can wane over time as well. And so I would not put your bets into natural immunity because it's not guaranteed.
So I think that's a great segue to us now going to speak to a doctor who's actually the director of the Pediatric ICU at Our Lady of the Lake Children's Hospital in Baton Rouge, Louisiana. The situation is dire there. So when you think about the chances of this natural immunity not working out in your favor, this is exactly what's happening for so many families, unfortunately. So if you are hesitant about the urgency, please listen now to what Dr. Kelechi Iheagwara has to say. Here she is.
My name is Dr. Kelechi Iheagwara. I am the medical director of the Pediatric Intensive Care Unit at Our Lady of the Lake Children's Hospital in Baton Rouge, Louisiana. We have been struggling with COVID for the past couple of months. Our COVID numbers in children continues to increase, but the rising number of COVID positive children coming into our emergency room is scary. We went from seeing maybe one patient, one pediatric child with COVID once every week, to seeing about 7 to 10 a day. So by the end of July, we were pretty much panicking because we knew we had a problem. We have seen kids, honestly, all ages, from 2 weeks of age up to 18 with COVID. And all of them, none of them obviously has had the vaccine. We have not seen one single pediatric patient admitted with COVID that has been vaccinated. I have 3 kids of my own, and I worry about them every day. There's also a subset of children that get COVID and they stay home, they're fine. For them, it's just a simple cold. But then we see them in the hospital, 3 to 4 weeks later with something called MIS-C, which is a post-COVID inflammatory disorder that causes their hearts to get inflamed and their organs to be inflamed. And these kids are very sick. Some end up in the ICU, some end up with myocarditis, like heart condition. So it's real and it's serious.
So yes, I mean, you've heard it there directly from someone who's a mother, who's a doctor, who's really on the front lines and seeing it for herself. So Dr. Beers, our kids make up roughly 25% of the American population. Can you explain for us the role of kids in the pandemic and getting us to the other side of this crisis? By that, I mean, their role in keeping our communities healthy, our economies open and thriving, our schools open for in-person learning. How can kids play a role in that whole situation?
Yeah, absolutely. And I think, as we're talking, well, of course, children play a role in all of that in so many ways, right? But I think thinking about that in the context of COVID-19 and of the vaccinations, I think clearly the more people in our society, in our world, and in our country who have immunity against COVID-19, and I agree with Dr. Jetelina, I think the vaccine gives you much more consistent immunity without the risk of things that may happen to you if you get sick with COVID-19. So that the more of us who have immunity, the more of us who are vaccinated, the less people the virus has to bounce around to, and so the spread of the virus will naturally decrease. And with children as 25% of our nation, of our communities, that's 25%. If all kids are vaccinated, that's 25% less people who will be potentially potentially getting sick with COVID-19. I think I also want to point out that vaccinating children does play a really important role in helping to decrease the spread of COVID and help us really, again, kind of return to a time where we're not having surges and we don't have full ICUs and we don't have, we're not in these situations as was just described to you. But it's also really important for them. It's a safe and effective vaccine, as authorized, it's a safe and effective vaccine that can really help children stay healthy and well. And when they're healthy and well, they can be going to school and going to all of their activities and they can be doing all the things that they love to do, which we all know helps them get back to normal, helps them get back to being the happy, healthy, wonderful kids that they all are.
That is so true. And I think that's in line with what the researcher, Dr. Jason Salami, who's an associate professor of epidemiology at the University of South Florida, he has created an online dashboard. So again, I really want to stress here that this is, medical research from doctors and other experts who are tracking this in states like Florida. Jason is tracking this nationwide. And here for us, he's going to describe the data trends for children and what he's seeing with children who are vaccinated in their communities. Here he is.
My name is Jason Salami. I'm an associate professor of epidemiology, and there's been some information that's come out of the CDC on a study that suggested that hospitalization rates among unvaccinated children, 12 to 17 years of age, was 10 times higher than against fully vaccinated children. So vaccinating children absolutely protects them. It reduces their risk even that much more. Not only that, but we found that adults who are getting vaccinated can protect children who cannot yet be protected by a vaccine. And what I mean by that is, again, research coming out of the CDC suggested that communities with the highest vaccination rates among everybody who is a vaccine eligible age, they had children 4 times less likely to be hospitalized than in states that had much lower rates of vaccination. And so it almost forms a kind of protective bubble, especially around children who are my son's age, who cannot yet be protected through a vaccine.
So let's now talk about those kids. If I don't ask this question, my sister in Canada is going to have a word with me later because her children are not all going to be in the next cohort. They're under 5. So for all my, shout out to all my under 5 mamas out there. Please tell us, Dr. Beers, give us an estimate. I know you don't know because there's a lot of steps in the process, but roughly, what can we hope for here? Can anybody plan for the new year? Will there be a vax for the young ones?
I can definitely tell you what we know. And I think, again, this is back to what we talked about at the top of the hour, which is that there is a very careful and structured process for reviewing the data around this vaccine and all others. And so just in the same way that we talked about this sort of, series of steps where the trials are conducted and then the data is submitted to the FDA, they review it, they pass their review on to the CDC. So each of those steps will need to take place for the under 5s as well. So I'm kind of laying the groundwork to give you our estimate. But what we're hearing, and I should say that this is publicly available information that we have just like the rest of you. But what we're hearing is that this data will be available either the end of this calendar year or the beginning of next calendar year. And so assuming that everything continues to go as planned, we've heard nothing to suggest otherwise. Certainly, but each step of the way, it's important for each person who's responsible for doing that to take a look at the data. Again, nothing we've heard that would suggest anything's going awry, but if it all goes as planned, then we'll have that data sort of submitted and end of the year, beginning of next year, at which point then it'll go into that next process where there's a few more weeks where the FDA is reviewing the data and then passing it along to the CDC. So that was a long way of saying hopefully probably early next year, maybe a little bit later, but if all goes as everyone hopes, then that I think is a realistic estimate.
So maybe there's hope for spring break. Don't book the trip to Jamaica yet, but there's hope, maybe, right? Yeah. Okay. So Dr. Jetelina, let's talk about vaccines in general, because I feel like somewhere along the way, we went off the track. We all marched our newborns to the doctor, pediatrician, come in, get the vaccine for all the things, 5 at once. We're getting all the shots for the mumps and the polio and all the things that we standardized, measles, all the things. Didn't think twice, did it? Now suddenly all the debate. Tell us for a second, just a little 101 here. Do all the vaccines work similarly? And I want to ask, should parents also opt to get the flu shot at the same time as the COVID vaccine when they take their kids in? I got asked this question and I was kind of caught off guard. I was like, oh, I don't know. Do I want both? Is there any reason why? I don't know. I don't know what to think anymore, you guys. It's crazy time. So tell me, A, do all the vaccines generally function similarly, and any risk to taking more than one at the same time?
Yeah, so the vaccines get to the same endpoint. How you get to that endpoint slightly differs. For example, the flu vaccine does a little different thing than the mRNA vaccines, which does a little different thing than the Johnson & Johnson vaccines. But ultimately, what they do is give your body instructions or show them your body how to fight this virus whenever you come in contact with it again. Now, to your second question, in the beginning of the vaccine rollout, the CDC said out of a precaution that you shouldn't get 2 vaccines within 2 weeks. Since then, they have updated their recommendations after seeing all of the data that, you can get the vaccines the same minute if you want it. I mean, you can get them at the same time. Some are suggesting maybe try 2 different arms, but really the thing is you're just going to get a sore arm or 2 sore arms. There's no interactions that we see between the COVID-19 vaccine and other vaccines, and we don't expect to see any interactions. So if you're like me and have a crying 1-year-old, might as well just do it at the same time, so you don't have to go back in. But yeah, you certainly can get them at the same visit.
So we're busy. Listen, nobody's got time for 2 doctor's appointments. Just go, boom, boom, 1 shot, done. Okay, moving on. Next. All right. So Dr. Beers, question from our audience. If it's effective, why do we need boosters? Talk to me about the booster drama here. What's the situation for adults and kids?
This is a great question. I'm glad you asked it. So I think the first thing to remember, right, and think about all of our childhood vaccines. When you brought your kids in for their shots, or when you yourself got your shot, most of them require boosters. That's a very typical thing in vaccine development. It's just a very typical thing. It's how vaccines work. They sort of the first dose or 2 stimulates the immune system to begin making those antibodies, and then that booster dose really sort of seals the deal, I guess, right? It seals the deal so for a much longer period of time. And so I think it's important for us to remember that this is very typical. This is sort of how vaccines work. I think the other important thing to know is that part of how we know when a booster dose is needed is by seeing when the immunity starts to dip off a little bit, which we're tracking in the clinical trials. And that for most vaccines, it's, you might need a booster 6 months later, or in some cases a couple of years later, right? So we're right. This is all expected. We're right at the timeline in the course of vaccine development where we would start to expect to see in the trials, like, oh, okay, the immunity is dropping a little bit, so we need a booster. And then based on our prior experience and prior knowledge, we think that this is very expected. So that that's why we need a booster, is because that's kind of how vaccines work in the way they stimulate your immune system, and that this is a really pretty typical thing and typical part. I also want to kind of reinforce, and we've talked a little bit about the breakthrough infections, but really, breakthrough infections are very, very uncommon. Like very uncommon, like 1%. They're very uncommon. The reason we sort of hear more about them is because really so many people are getting this vaccine all at once, which is just giving us a lot of data all at once. And also the rates of the virus right now, particularly in some communities, are really high. And so, if you have a vaccine that's 95% effective, which is actually really good. It's better than most of our vaccines, actually. If you have a vaccine, like the mRNA vaccines, that's 95% effective, and you're, in a community or you're somewhere where you don't really get exposed very much to COVID-19, well, then you're much less likely to get a breakthrough infection. But if you're somewhere where you're exposed to it on a really, really regular basis, then it means that, that person whose immunity may, that 5% may be more likely to get more likely to actually get exposed to COVID and get sick.
Oh, that's great. A great explanation for folks to understand there. Most things need a booster, right? Okay. So I'm thinking back to the olden days where we had friends and family come over. This was all lovely. No one wore masks. Beautiful. Okay. So the thing that I miss about the pre-COVID times is hosting a celebration for my kids at home. I think that's one big thing that we can think about when we think about why should we go through this whole thing. It's getting back to living, right? So I want to play another PSA from our friends at the Ad Council about getting back to the moments we love. Here it is.
Resuming moments like these starts with protecting our kids against COVID-19 and dangerous new variants. Get the latest facts by visiting getvaccineanswers.org and speaking to your pediatrician or healthcare provider.
So I love seeing the joy in this video between two friends who are being reunited because, it's really, that's what we've missed, right? I want to just talk for a second about the mental health impacts of, this whole time on our kids. We've had a lot of them at home for a time, remote learning. My sister texted me the other day. Like I said, she's got 3 little ones. She's like, and she's a teacher. She's like, do you think it's okay if I get a fully vaxxed babysitter? I'm going to lose my mind. She's been home for literally 2 years with 3 toddlers. Why should we really consider the mental health component of this crisis, Dr. Jetelina? What does that mean for children?
Yeah, it's been a really tough 20 months. We can't underestimate that. Kids are incredibly resilient, but they can also be impacted as well, especially without those social networks, without going to school. A lot of kids didn't have access to food, a lot of food insecurity. There's a lot of traumas. The thing I'm most concerned about is how we address those traumas going forward, that we need to have conversations with kids. If it's not parents, because sometimes kids don't listen to mom and dad, maybe it's aunt and uncle, maybe it's a counselor at school, but we need to start addressing this trauma. We study this thing in epidemiology called adverse childhood events, which means that if a kid goes through a traumatic event, like the pandemic, for example, it can have an impact on them for years and years to come, especially if it's not addressed in the forefront. And so we really need to put the effort into doing that and really get our kids back to school. Vaccinated, I didn't know about the whole Miami thing until you said it, but we need to get them back to school.
We need to get them back out there for sure. And so we have a ton more questions coming in from the audience. Keep your questions coming, folks who are out there watching. Dr. Beer, why don't you take this one? Can you speak to the prevalence of long COVID among children and adolescents?
Absolutely. And this is one of these things that makes us worry about COVID, right? And worry about COVID and infection. And when we think about why we want to prevent this in children and in adults, because it can have long lasting effects. So I think most of you are probably familiar with people call it long haul COVID in adults, where you have symptoms for a prolonged period of time. You can have that in kids too. And it can happen sometimes in kids who've had very serious COVID infections, where like they really were ill. And you can also see it in kids who have had very mild or almost asymptomatic COVID infections. And so, I guess the good news is that as they're following these kids after, most of them have had their symptoms resolve, within 6 to 9 months. The bad news is 6 to 9 months is a really long time actually to be experiencing some of these symptoms. There are things like fatigue and dizziness and headaches and things that are really debilitating. I've just spoken to a lot of pediatricians who've taken care of kids in this situation, it inhibits them from playing sports and going to school, and it really does have an impact on their lives. So, and again, it's not, it's a relatively small percentage of kids who do experience long COVID, but it's still too many, and especially too many when we could have prevented these infections, or we hope we could have prevented these infections with a safe and effective vaccine.
Okay, that makes a lot of sense. Now, Dr. Jetelina, let's go for another one from the audience. If a child has had COVID, is it possible that a second dose of the vaccine would not be necessary, or do you always recommend both doses?
Always recommend both doses. Like I said, it's not guaranteed that natural immunity will stick or will stick for a long time. And so we really need to be consistent with these vaccines. We need to get inoculated the way we studied them in clinical trials. And so we know how to better guide them later down the road, maybe in 5 years when we need another booster. And so it's really key to stick to this schedule.
Don't go rogue, Rachel. Just follow what the doctor says. Okay, here we go. Dr. Bierce, where will the vaccine for kids be distributed? Will it be at pharmacies, Department of Health, or just pediatrician offices?
Yes, and yes, is what we're hearing. So, and in our conversations with the administrator, we've certainly been talking to folks saying we know we're hearing from lots and lots of parents who are eager to have this vaccine, and we want to make sure we can partner with you in whatever way we can to help make sure that families can get it. And so what we've been hearing is that the administration in the states are planning to distribute the vaccine in all of those places, because they want to make sure that families are able to have good access to the vaccines. The other thing that they have told us is that, because we know when we've done different surveys and talked to parents, we've learned that the younger a child is, the more likely a family is to want to get their vaccine at the pediatrician's office. And so that is one thing that we've heard, is that for this particular age group, they really are going to be focusing more heavily on the pediatrician's office than they did with the other age groups. So I think that's good news for lots of parents who really would prefer to get their vaccine at the pediatrician's office.
Or you can come to New York City. They give it to you in the subway. You get it to you anywhere you want, the street corner. There's a van everywhere. People come. If you can't find it, New York has got it everywhere. All right. Let's see here. Another question, Dr. Jetelina. This is from our audience. Clarify some potentially misinformation here. I get that the vaccine will not cause fertility issues, but will it create potential genetic issues in the offspring of vaccinated children in the future?
No, it won't. The mRNA, there's no biological way for mRNA to change your DNA. We actually have mRNA all over in our body already. And so, the mRNA cannot get inside where your DNA is created. And so there's no reason it could ever change your genetics. We do have DNA vaccines. That's a whole different misinformation story, but the mRNA vaccine doesn't even come close to the DNA. doesn't have the tools to get close to it.
There's no linkage here to the genes and the juice they're giving you, right? Okay, no linkage. I like that. All right, Dr. Beers, what would you say in response to the Israeli study that said natural immunity is stronger than vaccination? Again, I'm paraphrasing from the audience. I don't know if this person has all the facts.
Yeah. So, and I'm happy to have Dr. Jetelina comment on this too. But you know I think Dr. Jetelina talked a little bit about natural immunity and you know what that means, and that in some cases it could be strong, in some cases it might not be, and that it's a little bit more inconsistent. And I think, you know, one of the things that they actually did see in that study was actually the combination of natural immunity and the being fully vaccinated was actually really what gave you the strongest immunity. So I think to me, what that tells me is that even if you have had COVID, it still is really, really important to get your vaccine.
Okay, we have 6 minutes left. I'm going to try and get to as many questions as I can here. Dr. Jetelina, are these doctors making money for giving the shots?
No, I don't think so. The vaccine is free. It's covered by the federal government. I think where you may get fees is an administration fee. So if you have a doctor's visit to get the vaccine, that's when they can charge you for their time to administer you the vaccine. But that's it. If you go to a pharmacy, the vaccines are free. I know all across the nation, health departments are giving out the vaccine for free as well. Like you said, you can have a van on the corner. I don't know if I'd get my vaccine from a van on the corner, but you can get it from them too, or in the subways.
It's fine. I'm fine.
Okay, perfect. But no, they're not making money off of the vaccine at all.
So it's not like Zara where there's a commission if you sell more shoes that day. If you give more shots, that doctor is not making any more money. There's no incentives here in terms of like kickbacks. Just want to clarify that.
That's true.
Okay.
No.
Okay. So everyone wants to know about the ovaries. This rumor won't die. Dr. Beers, one more time. Can you guarantee 100% no adverse effects to your ovaries?
Yeah, there's no link between the vaccines and fertility. So, and I think, you know, getting back to some of the things that Dr. Jetelina was talking about earlier, our experience with vaccines really throughout history, you know, of the vaccine development. You know, this is a I guess rumor or piece of misinformation that sort of comes up a lot. You know, I understand people ask questions, they want to know, you want to know good information. And it's really never been proven for any vaccine. And we have no reason to think that it would be the case for this one. There's no link. We've definitely seen lots of patients who have gotten pregnant after getting the COVID-19 vaccine. And yeah, so no, there's no link.
I do want to add, Michaela, that, you know, anti-vaxxer movements take advantage of this fear of fertility and vaccines. And it's not just the COVID-19 vaccine. We've seen this over and over again with the HPV vaccine, with Hep B vaccine. Even in some developing countries, they still have polio because of widespread fear that polio vaccines cause infertility. So it's a very common misconception. And I think that we should expect misinformation to circulate in the next upcoming weeks. And so if you see that misinformation, certainly go to solid sources to make sure if that's a true thing that's happening or it's a rumor and misinformation or disinformation.
GetVaccineAnswers.org, healthychildren.org, 2 places you can get information. Again, I say it's from medical experts here, not your cousin, sister's friend. Okay. We want to go to the places written by the doctors. All right. So what else? People are asking a lot of questions here about the brand of vaccine, one versus the other. So Dr. Beers, maybe you can just clarify for us, the vaccine that's going to be first available or authorized for children under 12 is going to be Pfizer. And down the road, is there any differences between the various vaccines that parents should be aware of?
Yeah, I mean, I think our recommendations are that anyone who's eligible should get the vaccine that is first available to them. And so, I think that holds true now. I think that will hold true if and when we have other manufacturers who have vaccines available for younger children. There, as you all know, there's of course differences in the interval between doses and other things like that. But our recommendation really is that they are all safe and effective. They all work very well. They're all very safe, and that as you should get the one that's available to you as soon as it is available to you.
And in terms of the boosters, I know this is just still emerging, so we don't have a ton of information on the combining of one versus the other. So I would say to folks, and maybe you agree, to check back in the coming weeks on the latest research for what they're saying about the boosters. Would that be fair to say?
Yeah, I mean, we should actually expect answers on Friday. So I think that we'll have a lot of clear guidance coming up this weekend / next week. So yeah, keep your New York Times article breaking news close to you.
Awesome. Okay, I love that. So we are almost out of time. I feel like we could have talked a whole nother hour about all these questions because there's so many things to consider, but we are so lucky to have had both of you here with us. I want to let everyone watching know that our next live event will be on October 26th, and the topic is decoding our true crime obsession. Yes, we are talking murder in the spirit of Halloween. So if you like murder, like me, join us for a chat with true crime journalists, including Yeardley Smith from Small Town Dicks. Register now at scarymommy.com/live-work-thrive. So I want to thank both of you, Dr. Lee Savio Beers from the Academy of Pediatrics. She is the president. She is here as a mom telling us all of these important pieces of information. If you want to hear more, visit healthychildren.org. There's a whole section on vaccines and so much more. It's very useful. I went to your site this summer for some information on life jackets and I was blown away. It's fantastic. So much great stuff there. And Dr. Katelyn Jetelina. Now, I want to just point out that this woman, okay, she is an epidemiologist, working professor. Also, go to her Facebook page and all of this stuff. She's doing this literally for the goodness of all of us out there. Okay. She is not getting paid for that. She is just sharing her research. Okay. Please join her GoFundMe campaign. Let the woman live. I'm sure she needs a Starbucks in the morning, something. Give her a boost from one mother to another. Thank you so much for all you're doing for everyone out there. The information is so valuable. Thank you also to Dr. Jason Salemi and Dr. Kelechi for joining us. Don't forget, visit getvaccineanswers.org to get the latest information on the vaccines. Learn what you need to do to get you and your children vaccinated. The site has a special section devoted to parents where you can find answers to the most commonly asked questions. So have a great night, everyone. Like most things in motherhood, it's up to us. Like really, at the end of the day, who's going to get us through the pandemic? The moms, right? It's up to us to get the information we need to make the right decision for our families when it comes to keeping them and our communities safe from COVID-19. Be well, stay safe, and get back so we can all live, work, and thrive. Good night, everyone.